Hello, I'm Lily Julinas, Editor-in-Chief of American Nurse Today. The topic for this month is critical caring, the importance of nursing to patient well-being. The importance of nursing to patient well-being is a time-honored concept, but often difficult to measure. If it were so easy to quantify, we would stop debating the business case for nursing and trying to prove the value of nursing in hard dollars. We would clearly know the nursing return on investment, or ROI. So why does healthcare have such a hard time appreciating the full benefit of nursing's work? This question seems harder for nurses than for those we actually serve, who can more readily provide the answer. Just look at the more than 425,000 stories that have been written about nurses by patients and their families as part of the DAISY Award program. During my National Nurses Week recognition rounds in May in many of our hospitals, I witnessed an example of the value of nursing, and I'd like to tell you about it. It's how bedside shift report saved a life. I was in a reception and a nurse manager came to me and said, "We just saved a life this morning because of bedside shift report." I immediately went upstairs and I talked to Jennifer, the nurse. What happened was Jennifer and the off-going nurse went to the bedside and they noticed clinical deterioration in the patient. Jennifer told me that bedside shift report saved this patient's life. And if she'd given report the traditional way in the nurse's station like we have for years, it would have prolonged her entering the room and performing the morning assessment with her colleague. So when nurses are fully present, when tuned in to our patients and centered, our responses are faster and our minds are clearer. Making the invisible visible is what bedside shift report is all about. Why is bedside shift report called a leading practice, yet we struggle with ensuring it becomes common practice? Nursing's most important work can be subtle, almost invisible. It requires critical thinking and connecting the physiologic dots. This mindful way we process patient status is what differentiates nursing. We use intuition as intervention, the ability to highly integrate nuances others might not see. Be sure to check out the other great articles in this month's edition, such as Conscience, Legalism, and the Clash of Rights. What happens when your conscience is at odds with expected actions? What do you do? Also in this issue, doctor shopping and prescription substance use disorders, with key strategies to help identify these patients and how to treat them. And a forward-thinking article you might want to check out is how the world of Twitter is being used as a tool to help showcase nursing excellence. And now I leave you with this: nursing interventions, those invisible talents that are best displayed through our professional discipline, clinical knowledge, and engagement with our patients, can only be fully realized and become more visible when we're at the bedside, the best place for critical caring.